Well, thank you very much, Divya, for being here. I'd like to do some brief introductions to start. My name is Anant Nyshadham. I'm co-founder and chief strategy officer for Good Business Lab. And thank you for joining our new thought leadership platform, GBL Access, where we want to talk with top practitioners like yourself, researchers, and so on to kind of bring the insights of research on the topics that we kind of have shared interest in to a broader audience in a conversational manner like this. So if you wouldn't mind, please introduce yourself, your background, and kind of what you do with IDinsight.
Sure, it's a pleasure to be here. I'm a director at IDinsight. I've been at IDinsight around 4+ years, and I can give you a little bit of background about IDinsight, if that's useful.
Yeah.
We provide data and analytics to a range of partners, government, a lot. We work quite closely with government in India, and also with non-governmental organizations and funders. And the idea is really to push for evidence-based decision making. So our skill set is, we have strong technical backgrounds in statistics, public health, econometrics, etc. Personally, I have a public health background and a public policy training. At IDinsight, I've been leading quite a bit of our health and nutrition work. And in the context of COVID, because, for all the linkages, I was leading the COVID task force. And today I was hoping to talk to you a little bit about some of the work we did, specifically in terms of collecting primary data
Yeah.
from across India, specifically rural India. And we were able to kind of do this at scale rapidly. So happy to talk a little bit about the process and the results.
That's great. That's exactly what I think I certainly would like to hear, and I think the community at whole would like to hear about. As you mentioned, I'm well aware of IDinsight's work kind of broadly in work, worker experience, migrant workers in particular, even before the COVID pandemic, and also, of course, in government programs, public goods provisions, and so on. What did your most recent kind of broad scale surveys kind of show about specifically the migrant experience, maybe their expectations about the pandemic, and also kind of their interactions with relief efforts from the government?
Yeah, sure. So I'll give you a little bit of background about, who we were talking to and what kind of data we were collecting. So we have done about 7 rounds of large household surveys. There was one set that was focused on basically the poorest parts of the country, mostly, north and eastern parts of India. And the household survey size was around 6,000 households. And we were looking at COVID knowledge, attitudes, practices, access to relief, etc. Basically, we started 10 days into the lockdown. So, April 10th was when we were collecting data, and we were able to provide that data to government. And then we also did another 3 rounds. So that was 3 rounds. And then we did another 3 rounds focused on the rural economy. So those 3 started in May. And that was focused a little bit on income, labor force participation, and also on, again, access to relief, etc. What was, in terms of the migrant aspect, across our surveys, around 20% of households report having linkages to a migrant. And again, to give you context, the way that we sample these households is this was pre-COVID in person. We randomly select households, and they're representative of various geographies. In this case, 6 states for one set of surveys. So around 20% of households report a migrant, and around 78% reported having a migrant come back to their houses. So this is a huge number, right, across 6 major states of India. And what we see across households is large losses in income and earnings, in terms of, and what's interesting, because we were able to do this so regularly, is we see there's a lot of dynamism. So soon as the lockdown started in April, 70% of households were reporting that they had either lost their job or experienced a reduction in income. And this definitely has changed and improved. And what we find is that for migrant households in particular, 64%, so 2/3 of migrants in September were still reporting no work. So that's a huge number. So 64% of migrants were reporting no work in September. And interestingly, we also find that, when we look at the amount of work that they've done, we compare, for example, of those who have returned and those who've stayed. Those who've stayed are, just able to get about 1.6 days of work, compared to those who've gone back. They get about, 4 days of work per week. And so, it really is, as you can see, a dramatic change in their livelihoods and their lives. So yeah.
So it's affecting a lot of households, especially early on. There's a lot of households who are having migrants come back. There seems to be a clear pattern that if they are able to go back, then obviously they are getting more work, but there's a whole bunch of them who are not actually, even many months after you started this, able to
Exactly.
actually
Yeah.
And so then what, do you have a sense, early in this kind of these rounds of surveying, was there an expectation among the households that indeed it would last this long, or that they really would be still out of work many months later? Or did you ask that in the earlier rounds?
That's a great question. We actually did. So in May, when we asked this question, 90% of households were optimistic, and they were expecting to return back to their occupations. So this is, a month or so into the lockdown. But as I said, in September, we still had a large proportion of households who were still unemployed, and specifically migrant households. So, because they had returned and they weren't able to go back.
That's what I suspected. That's kind of been the experience that we've all had, right, with the pandemic. That
Yeah.
it always kept being worse and longer than we ever thought. And that really, I think, interacts with relief efforts to some degree. So, I mean, I think early on, how many were seeking out relief or availing themselves of relief? And then as it kind of progressed, obviously, I think it sounds like the need for governmental relief, like resources, was probably, higher than maybe they expected it would be. More of them needed it. So how did you see some trends in that, or patterns in access to
No,
relief?
the relief story is really interesting because basically over a month, like in April, when we did the surveys, a small proportion of households were able to access relief. And, that was worrying. And it was also understandable. It was, there was so much uncertainty in terms of how the disease is spread and, how long this whole experience is going to last. But within a month, starting in May, PDS in particular was reaching 90% of the households. So that story is something that, is pretty impressive and amazing. And, I feel that we don't talk much about that. Is
Yeah, it's a nice
90% of
positive point in, if you rarely hear a positive point like that there really was,
Exactly. So 90% of households, and this is consistent, right? Like across our surveys, we're seeing this, were receiving free rations, so rice, wheat, pulses, on average around 22 to 24 kgs of, rice or wheat. And basically we did the calculation and it comes to around 76% of their cereal needs were being covered by PDS. We do also look at other kinds of relief, and that the story is more mixed. For example, Manrega, which is very important for these households, we find that only 39% of households are receiving the access that they want, so are able to receive some days of work. So basically, there's a need, there's they're trying to access it, but they're not able to get those days of work. So that was one. And then similarly, going back to PDS, we find it to be quite progressive in the sense that poorer households are accessing it more. But when you're talking about cash, like, cash transfers, we found it to be more regressive. So, the more wealthy households, and wealth is obviously relative in this context, are able to access cash.
Yeah, that's kind of a hard stat to hear, but maybe not that surprising in the sense that the cash might involve a level of sophistication or access technology, or maybe already being registered and enrolled in some way. Is that part of what goes on here? What do you think? Do you have any insights about what drives the kind of regressivity in the cash versus, despite the PDS being kind of a more progressive distribution?
Yeah, it's an interesting question. I mean, we have hypotheses. One thing that I can say is we asked about whether they could access the cash, and that number was very low. It was actually 3%, in the sense that they were either using business correspondence or able to go to an ATM, etc. So in terms of access to cash, that was not the problem. I think the challenge is more in terms of the linkages in terms of bank accounts and being able to know how to get access to the money that was there, if they knew that the money was there. So
Yeah,
it's
this kind of
more
broad financial inclusion kind of thing. It's
exactly.
knowledge, but also then confidence in accessing those channels. It's all these elements. It's not just about access in the kind of theoretical sense that, okay, you're
Exactly.
eligible and you can go there, but you have to have all the information you need to get there, and the knowledge of how to do it, and maybe the
Yeah.
confidence.
Yeah, the term that they use, which I like, is this process literacy, right? Like knowing the process of
Yeah,
how do you go about doing this and
and that's so
actually
powerful.
getting
We
it.
sorry, yeah, actually getting it exactly. I
Yeah.
think we've seen that that's so powerful in so many settings where any government resources or entitlements and these types of things. But and it's interesting to see that even in a pandemic, when there's desperation about, still that process of literacy can matter. It's not as if it's a laziness or a lack of effort, that like, oh well, if I
Absolutely.
really needed it, I would go and figure out how to do it. No, there's real barriers to
Yeah.
knowing the
The fact
process.
the fact that the poorest are not able to access it says a lot,
Yeah.
also. So yeah.
And did you ask anything about preference between cash and in kind? So do you have a sense that the poorest would, I mean, maybe it's a silly question, but they would actually prefer maybe cash, or they certainly have residual demand for that cash relief, despite being,
Yeah.
having PDS accessible?
We did ask the question early in the lockdown. And at that point, as I mentioned, relief was not reaching. And then there was a preference for in kind.
Okay.
But yeah, we did not ask that question again.
Okay. Okay.
Yeah.
Interesting.